on the topic of risk a little bit. And so, Dr. Ellis, most coronary artery disease can be prevented or managed through lifestyle changes and treatment if caught early. But the healthcare system has done a poor job of identifying those at risk, especially women and people of color. So let's talk about specifically kind of what are the cardiovascular risks for Black women in particular. Dr. Ellis?
So family history, diabetes, cholesterol, smoking, and a lot of family history actually is cholesterol, and then also weight and overall condition. One of the things about the African American community, we have a different body image, and some think it's healthier or not, but anorexia is not as prevalent in the African American community. I mean, could you imagine going to your grandma and throwing up her good cooked food on purpose? I mean, you might not live through that.
I'm dodging a wooden spoon right now at the thought of it.
Right? So, and it also has to do with poverty. If you go back 50 years, if you were thin, it was because you were poor. It wasn't a fashion statement. So we have a different image. And so to tell people that they need to lose some weight and then not really give them any tools or reasons for it, and so that goes towards the diabetes. And that also then goes towards the family history because of the survival. But then the cholesterol and the blood pressure. Blood pressure is such an undertreated issue. I mean, how many patients do you have that don't take their blood pressure pills until they can feel it? And I say to them, if you can feel it, your head is about to pop off. Take your meds. Well, I don't like the way it makes me feel. Well, that's when you need to have a further conversation with your doctor. When I tell my patients is that when you take your medicine, it should feel like you're eating Tic Tacs. And if you said, if you eat these 12 Tic Tacs a day, you will live longer, people will be, sure, I don't care. If you feel it, instead of just stopping your meds, which is something that happens in the African American community, tell your doc, it made me feel bad. There are 25 different cholesterol medications. There are probably 50 blood pressure medicines. There are now so many different ways to treat diabetes. We can find something that it should feel like you're eating pebbles. But the only way we know that your cholesterol is good is when we do the test.